Hi, I'm Dr. Andrew Kassinove, and I'm a physician in the emergency department at JFK Memorial Hospital and the medical director of the emergency department. So the emergency department is open 24 hours a day, 7 days a week, 365 days of the year in the age of COVID. So the hospital ensures the safety of emergency patients coming in during this time of COVID by having a triage set up outside of the emergency department where patients that are suspected of having COVID go through a totally separate pathway separated from the other patients. So in this way we don't intermingle patients who were concerned about COVID with other patients. So right now in the age of COVID, you cannot bring a companion into the emergency department with you, unfortunately. In severe circumstances where someone's life is at risk, then we will allow family to come in, but we're really restricting it during this time. So when it comes to minor children, one parent can accompany them into the emergency department. So if a pregnant woman is close to delivery, you should absolutely feel comfortable to come to the emergency department. You will actually be immediately triaged to our OB department if you're close to delivery, so you won't be in contact with any COVID patients. So if you have COVID-19 symptoms, you absolutely can come to the emergency department and we will evaluate you. One of the important tests that we do is a pulse oximetry to make sure that your oxygen level is safe. And that's not something you can typically do at home, so we're happy to check you out and evaluate you. So please don't wait out your symptoms at home for any disease process that you would go to the ER for. We're open 24 hours a day. Don't be afraid of COVID. As I've said, we have a separate pathway for patients that we're concerned might have COVID, and we keep regular patients separate from them, and we are happy to evaluate everybody regardless of what your symptoms are. So the danger of waiting too long with symptoms is that you can end up in much worse shape. So for example, if you're having abdominal pain, your appendix could rupture, and that could lead you to become septic and get very, very sick. If you wait too long for chest pain or other symptoms, you might have a heart attack and die at home. So please feel free to come in no matter what your symptoms are, and we're happy to evaluate you. So if you're experiencing symptoms of stroke, which could be a sudden change in your mental status, an inability to speak, maybe weakness on one side, a drooping of your mouth, please immediately call 911 or come immediately to the emergency department, because time is of the essence in terms of our being able to administer the right treatment, save your brain, so please don't hesitate. The same thing applies to heart attack. Time is heart muscle, and if you're having any symptoms, either call 911 or rush right over here and we'll take good care of you. Across the country, we're recommending wearing a mask outside in public. So you should wear your mask and come, and then we'll evaluate you. You don't need to do anything beyond that, and we will take good care of you when you're here and make sure that you're safe. As an emergency department, we are here to take care of you and your families, and please don't let COVID end up with having a bad outcome at home that we could have helped you with and prevent you from ending up with a heart attack or a stroke or a ruptured appendicitis. And we're here for you. We'll take good care of you. Don't hesitate to come see us.